The Grayson-Jockey Club Research Foundation has funded research throughout CSU for decades now to allow us to not only accomplish our research goals but train future scientists. So the most recent grant is basically looking at some of the antimicrobial effects that mesenchymal stem cells has. We've brought together basic scientists with myself and our team.
We clearly share an interest in stem cells and stem cell technology, and our lab works with mice and dogs in the clinic, and Laurie works with horses in the clinic, and just kind of evolved into a collaboration, really kind of cemented with graduate students that we've both trained together.
These are 7 other grants that I contributed to that were non-funded.
A very important part of what we do is training the next generation. Dr. Pezzanite did her surgical residency here and is now carrying on in research, and she is going to be the next generation of translational scientists.
Nowadays, research is a team sport. You got to be putting together a good team to be successful.
I have the privilege of being on the PhD committee for Lynn Pezzanite DVM, and I'm here as her translational mentor. Lynn is working on some really novel stem cell therapies that will help with orthopedic infections, either septic arthritis or infections within joints themselves, which humans also experience and can destroy joints if they're not treated appropriately.
My research associate, Nikki Phillips, has a daughter, Mary Grace, and she has had severe orthopedic disease, and so she's had many different orthopedic surgeries to correct angular limb deformities.
She's had over 40 surgeries in the last 13 years.
Hey, how are you? Good to see you.
Mary Grace is just a wonderful young lady, and I've had the privilege of treating her.
So Dr. Jason Stonebeck is the doctor of Mary Grace, and he is on Dr. Pezzanite's committee. He's a collaborator of Dr. Dow's and myself, and so it's the whole team working to improve the life and the health of our human patients and our horse patients.
Stem cells are what tie us all together.
So one of the surgeries that she had to go through caused an infection due to decreased blood supply, and there were implants associated with it as well.
When she developed the infection in the foot, it would have been nice for them to use the stem cells to kind of eliminate that infection in her foot instead of having to go through surgery twice to clean it up.
There's a lot of hype around stem cell therapies now, and without that scientific support from Grayson, we would never be able to truthfully answer those questions.
It's terribly difficult to get rid of orthopedic infections with metal in the body, and can be very traumatic to a human to have to remove those implants to get rid of an infection and then re-implant them at a later date. So if we can find some sort of therapy that would allow us to treat those infections and clear those infections, that would be a huge game changer for human medicine.
This team wouldn't have been established without the horse beginning the research, and we started because we wanted to improve the life and the outcomes of our equine patients that are suffering from these orthopedic infections. And it's icing on the cake that human patients can benefit as well, but that translational value is huge.